So therefore, we could go see what they have, because like I said, that interactive training, we could learn from them, they can learn from us. That type of thing is also very important. We don't do that. Most of ours is in-house. Training takes a lot of time. It's an inconvenience. I mean, one, it's setting everything up, doing it, but the other is, stopping what you're doing on a day-to-day to try to carry it out. Getting people to come in that are on call. They're all working other jobs or doing other things. A lot of them are firemen. A lot of them do other activities. So they're not just sitting on their phone waiting for it to ring.
So this is not their primary job then?
No. Wow. Primary job is just our key 8 people down here. Everybody else up there is just on call. They work other jobs.
How did the on-call people get certified to be an on-call?
We have a course. We have a 40-hour certification course that Dr. Smers, one of our doctors, physicians here, has put together, and through the Undersea Hyperbaric Medicine Society, UHMS, has certified a course, which there's other courses nationwide that you can go to, but he certified a course for us here so that we can train these. Every once in a while we'll bring in a training class because we want to up our numbers of care providers, on-call care providers. And so we'll hold this course, getting familiar with what it is. Some background knowledge of diving, background knowledge of nursing, hyperbarics is always good because it adds to the training. But those are the people we kind of look for that training we're talking about. But we hold a course here to certify them to be a care provider inside the chamber.
What pools do you guys draw from?
The military's a key one. The military, the retired military, that type of area. Firefighters is another one. A lot of them have the EMT type of training.
Right.
But it doesn't stop anyone else. But like I said, those are the key ones because they come in with already a full tool bag of some sort. Nurses, doctors, like I said, EMTs, firemen, to the military, multiple different military diving.
On-call are just the people inside the chamber with the patient?
Yes. Well, not necessarily just inside, because we have a care provider that's outside so that if he needs to go in, if they need to be relieved. So yes, they are key to go inside the chamber, but we do have some of them outside also. When we call them in, the TC here, like I said, Balaram, he's going in, but we will have an outside care provider out here handling paperwork, handling administrative things, and if Jason needs to come out, then the other care provider can go in and switch places. And so we always want the backup of people. Within our training, we actually train so I'm able to go inside the chamber also. I drive, I go inside the chamber, I treat ACLS, I can do multiple aspects throughout the command, so we're not limited. I can only drive, I can only do this. So none of our on-call, yes, they're specifically care providers, but all of our full staff, we try to, I can't think of the word I'm trying to think of, but we multi-train, cross-train to the various fields.
I was thinking about that too.
We all oversee what we need to get done, so we work together as a team to accomplish it.
Now, how can you evaluate the training though, if it's effective?
Okay. I guess by the proficiency, what we're talking about, let's narrow it down to what we're going. Let's run a scenario on how long it takes to get somebody out, how long it takes to handle that situation. I would say that's where the evaluation. If we had to do it right now with us, it would take us and we'd all fumble around, we'd be tripping on each other and everything else. But once we do this a few times, your proficiency with having it happen, being able to do it with your eyes closed. Now let's smoke the room and do it. So I think those are the things that you would actually get, just like you did in the Navy. Blindfold you and get out from your berthing space. Same thing, and that's how you get your proficiency. Is just doing it, running these scenarios, throwing these twists in there. Even though they make it difficult sometimes, but throwing them in so everybody thinks and reacts on it, and then you just time it or
But they won't tell you when this is, so it's pretty much a surprise thing, or then you just react? How's that?
It could be. I mean, Doc could come out and say, no, like I said, it's kind of something we have to be careful on. Patients are in there, we're not going to start running scenarios and throwing them all on a loop. Now, we have tried to include some of them, hey, we're going to run a drill. So don't get scared. We might sound a
Right,
little excited or something else. Very minimal, because these are old, tender people a lot of
Right,
times,
right.
and they're scared anyways. They got claustrophobia. They got all kinds of things in there. They're breathing O2. I mean, so we had to be very careful. But a lot of times it's just after hours. After patients are gone, hey, we're gonna run a scenario. You're gonna go in. You're gonna pass out. We're gonna be at depth. Now we got to get a doctor in. We got to do this. At the same time of that, you're starting to convulse on us. So so it'll just be a thought of scenario.
Scenario after scenario.
Not normally something just spook out of the,
Because what I'm
Some
thinking
programs,
is, let's say for example on a ship, we have damage control.
Yeah.
So it's pretty much the same thing. Damage control.
Same
Got it. And that's how you also maintain.
proficiency
Proficiency,
with it. That's how you kind of regulate how training is going. That's how you keep everybody on board. Things always change. You got to keep up to date on it. So same thing with it.
Is there like yearly, biennial recertification?
Yes. We're getting ready to do a recertification right now. Every 3 years,
Every
we go
3 years.
to the UHMS, the medical society that we just talked about earlier, the Undersea Medical Society. They'll come and do a certification. We are a certified chamber to the nation of hyperbaric. And so we have recertification there. University of Hawaii also has their labs. They'll come in and do their walkthrough inspections. Our fire marshals, they'll come in and do their inspections. So we're constantly have these people. And it's always a good thing, because as they come through, they're just making sure they're making sure they see things that we might overlook because we just get used to seeing them there. So yes, there are constant inspections, certifications, and other things. And one of the key things, especially our oxygen system, is maintain them in a gas certified condition, be in the O2 clean or whatever. We can't just go out to Home Depot and buy a valve and stick it in our system. It has to go through $300 testing and everything else to make sure it meets the flow volume, make sure it meets all the specification it needs, make sure it's O2 clean and everything else. And so
It's like PLS.
all of our O2 testing and our air testing, quality testing. Our O2 that's brought in, we actually have to have a certification that comes with it saying it meets the specification 99.99995
Well, it's a
cleanliness.
This is a medical unit.
Mm-hmm.
You're putting something into people's bodies.
Yep. It's an oxygen therapy.
I see
It's
that
it's a
radio over
drug.
there.
Yep.
I mean, a stereo.
Mhm.
Does that for inside or just what is it for?
It can be. Right now it's just piped for outside. Don't, please. Don't. It is just piped for outside, but it can be. There are some setups that have TVs inside and other things, special TVs that are able to do it. Ours isn't really set up with that type of, space for it. So therefore we have it. But it's definitely, as we modernize, we'll be looking to do other things. But at this point, it's just external for out here, kind of break the monotony of the 5 hours of sitting here driving and watching that TV screen.
And what are you looking at on the screen? Is that
Inside the chamber.
Inside, yeah.
the,
The video,
environmental
right?
Control. Huh?
It's like a CCTV,
Yeah,
right?
it is. Yeah. We have environmental controls, so we can heat and cool inside there. Of course, when you pressurize the chamber, you're shoving all those molecules in, it gets hot. When you start coming to the surface, it gets cold because you're removing them. So we have a heating unit for it. This is a view you see here. Hand signals are done back and forth, so you're not always having to talk. Everything's okay.
So you
up with a blower, down
You
with
switch
something.
channels if the multiple
Yeah.
um,
Yeah. That's between
chambers
the
are
chambers.
being used. Yeah.
Yeah. The only ones that have cameras are these two big ones in the back, which this is what this controls. These here are just done through the port.
Got it.
Are you going to put a styrofoam head in?
Yeah, we can.
I'd like to
I know
stay.
George has got
but